The vast majority of women having their first baby don't give any thought at all to what life with a baby in the first few weeks is actually going to be like. Firstly, because you have a great big brick wall in front of you, which is the birth, and secondly, because unless you've actually had a baby before, you have no comprehension of what being a mother is going to be like. The hardest bit of becoming a parent is not actually the birth. Birth can be managed in whichever way it works best for you after you've had good discussion with your midwife and worked out what to do, what kind of birth it is that you would like, and being helped to have that. That's just one day in your life. When you get home with your baby, that is when the hard work really starts. You're going to be more tired than you have ever been in your whole life, and for longer than you have ever been. That's going to affect everything about how you behave with your baby and in your day-to-day life. Tiredness affects all of us quite strongly. It makes pain harder to deal with, it makes worry more worrying. You'll probably be very worried about your baby in the first 6 weeks. Is he or she well? Am I feeding them well? Are they doing the right things? Do they seem to be normal? It's a big thing when you actually get home with your baby and shut your front door and realise that you are responsible for a brand new life. For you, your body will be very different than it was even in pregnancy. You need to know what kind of bleeding you'll have, how long that will last and whether it's normal or not, and when and how to get help if you need it. You may have some stitches after a vaginal delivery or a wound from a cesarean section. Either way, these need to heal, and you need advice on how to help yourself heal in the best way. You'll probably have some discomfort and pain. Hormonal changes are enormous in the first days and weeks after you've had your baby. You'll get lots of aches and pains in the first few days after your baby is born. Lots of women describe it as a flu-like feeling as your body starts to return to normal. Returning to a pre-pregnancy hormonal state will happen quite quickly for women who are not breastfeeding, but for women that are, estrogen levels will be low until they stop breastfeeding. Before you get pregnant, your estrogen levels fluctuate a little with your monthly cycle. In pregnancy, they become many times higher than they normally are. In the first few days after you've had your baby, estrogen levels fall quite dramatically to below pre-pregnancy levels, whilst milk-making hormones rise sharply. This hormonal seesaw, mixed with happiness and relief that the babies arrive safely and the tiredness from broken sleep patterns, can make women feel emotionally upset for a short time, but it usually settles down. Some women get postnatal depression, which is quite different. There is a wide variation in degrees of postnatal depression, from feeling a little bit down for a few days, a few weeks, of not feeling yourself, to, for a few women, becoming a very serious state of depression which needs professional help. It's important that you get the right information on how to look after yourself after you've had your baby. Most mothers are very keen to make sure that they're doing the best possible job of looking after their baby and forget to look after themselves as well. It's very important that you mother yourself so that you can mother your baby. And that means eating well, resting enough, not rushing about, trying to get back to your pre-baby life as soon as possible. You should take some time out of life to get used to being a mother and to spend some calm, restful time with your baby. Getting information on what support you'll have in the postnatal period is very important, particularly if you don't have family support nearby. You will have some midwife visits to your home in the first 10 days. You may want to use the NHS system. You may want to use a private midwife or hire a maternity nurse or doula to help you. Another consideration that you need to think about, although it's probably the last thing on your mind, is contraception. Women tend to be very fertile in the period after they've just had a baby. It's not unknown, even for women that have had years of treatment for unexplained infertility, to get pregnant within a few weeks of finally having a baby. So it's really important that you get good advice on what contraception to use.